What's up, guys? Just a disclaimer before the video starts. I just wanted to let you know I am not currently a Case Western student. Everything that you're about to see is just stuff I researched. I promise you it's all on Wikipedia, okay? However, I just think it's like a great way for me to kind of compile everything together in a place that other people can find it helpful. It's also on Case Western's website, so all this information is freely accessible, so please don't think I'm like, bypassing any laws or anything like that. I'm just trying to use my experiences to guide anyone else that needs help, and I hope you find it helpful. What's up, friends? So if you saw my last video, you know that I went to Case Western to interview, and I vlogged my entire experience there. But I realized I knew too much about Case Western to just stop there. I have a lot of information, and I realized I really want to get it out there because I think it will help you, any of you who are thinking of applying to Case Western. Maybe it's your dream school, maybe it's a REACH school, whatever it is. It's something that you should learn more about if you're even remotely interested in it. More importantly, if you are watching this and you got an interview at Case Western, this is a must-watch video because I think I would have benefited from this immensely. And that's one of the biggest reasons I'm doing this, because I'm trying to take all the information I had, rather than just throw it away. I want to put it out there because I think there's a lot of people that could benefit from this, and that's the reason why I am making this video. With that being said, the first thing you should know is, even before considering Case Western, you should know that there are two programs Case Western has. If I had known this, again, lots would have changed. I didn't know this until I actually applied, but there are two main programs. The first one is the university program, and in the university program, it's 4 years long. It's the traditional MD program, and what that is basically you stay 4 years at Case Western Reserve Medical School, and you come out with an MD. 220 students matriculate. Matriculate is basically a big word that says basically enroll, which means 220 students will basically start Case Western Reserve University in the university program, trying to get a normal MD. However, there is also a second program that the Case Western Reserve University has in conjunction with the Cleveland Clinic. For those of you who don't know, the Cleveland Clinic is the second best hospital in the nation, at least according to U.S. News and World Ranking. It's a great hospital, phenomenal place, but more important than that, people who apply to the second program, which is called the college program, it's different from the university program. The college program is a 5-year fully funded MD. That 5 years is primarily because I think they get 1 year specifically just to do research. I didn't look too much into it. I didn't apply to the college program. I applied to the university program. But just know that the college program is there. But obviously, because it's fully funded, which means you don't pay a cent of your own money for med school, which is absolutely phenomenal, it also means it's more competitive. And on top of that, I didn't write this here. I mentioned it later, but I think it's about 32 students, but it may be more. But I just want you to know that these are the two different programs. If you want to read up on either of them, this presentation is going to be linked below. And on both of these links, it's going to take you to the website that provides you more information on it. However, I do want you to know that the college program and university program all have are on one application. I think you have to write one more essay for the college program or something. It's not that big of a deal. But basically, because I only applied to the university program, I only know a lot about the university program, and so everything you hear from my mouth here on out will likely be about the university program, not about the college program. Let's now go into what makes Case Western such an awesome university. First and foremost, it is the largest biomedical research institution in Ohio. If you're the largest anything in any state, that's pretty phenomenal, right? Secondly, affiliations. So let me give some context to this. In medical school, first 2 years are spent actually learning book stuff. You're going to open up your book and study. The second 2 years, however, are spent in the hospital where you're doing rotations and seeing what it's actually going to be like for you to have patients. For that to happen, the medical school you go to has to be partnered with hospitals. And the better those hospitals are, the more likely you are to learn, better material. And in this case of Case Western, it works out really well because they have really amazing affiliations. They have their own university hospital. They have the Cleveland Clinic, which, as I mentioned to you, is the second best in the nation. They have Metro Health. I think they have a VA there as well. It's amazing how many connections they have, and so you will definitely have some amazing, amazing times if you go to Case Western in your 3rd and 4th year. The other thing that's pretty nice about it, this happens to a lot of med schools now. It's not just unique to Case Western, but nonetheless, it's a positive part, is that it's pass-fail for the first 2 years. So, all those book stuff you're reading, I don't know about you guys, I hated taking tests when it counted for such a large part of my grade. And in med school, they understand that, and they try to make it easier on you by saying, hey, it's just pass-fail, learn what you need to learn in the best way possible, but don't feel pressured because we want you to do the best you can. So that's a good part about it. The other thing is Med school also, Case Western also has this unique thing called IQ groups. They're called inquiry groups, and that basically means that Case Western is very, very big on problem-based learning. Problem-based learning is a big thing in medical school for some reason, and it's because it focuses more on an active learning process. Most of you may be accustomed to high school and college where you have to read from a book. Case Western does it a bit differently because what happens is you get a case. You'll say patient Y has symptoms X, Y, and Z. He has been going to the doctor for 5 weeks and nothing has changed. And what exactly is going on? So you have to kind of think actively, put yourself in the situation of a doctor, and get yourself to see what is wrong instead of actually memorizing stuff in a textbook. So that's one thing I really liked about Case Western because it focuses on this active learning part. And you meet with a faculty mentor, obviously, who kind of guides your group. You have about, I'd say, 7 to 9 people in a group. I don't know, again, because I've never been in one. I got to shadow one when I interviewed with there, but I'm vaguely recalling all this. You meet 3 times a week. All right. Another aspect of Case Western is that it has a required research thesis. This is a recurring theme in medical schools. Some schools have a required research thesis. Other schools have a recommended one. Nonetheless, a research thesis, I personally think, is a phenomenal idea, primarily because it gives you a chance to focus on your interests and really make sure you have something aside from just studying that you are passionate about. Because as a doctor, you will want to make sure you care about multiple things, and research is a great way to add on to that to those interests. The last thing I will mention is, as I mentioned to you, the first 2 years of medical school are focused on learning book work. However, the second 2 years are focused more on practical stuff and the actual treating of patients. However, most med schools will try to make it a point that even when you're in your first 2 years, you still get patient interaction. The way Case Western does it, at least from my knowledge, was that they had a free clinic. And that free clinic is the Free Clinic of Greater Cleveland. It's a great way for students who are in their second and third year, all right, and who are in their first and second year and not in the hospital yet, to still get an exposure to patient interaction. What else makes this awesome? Well, the curriculum is pretty great, and the reason why it's great is because it's block based. Depends on what kind of system you guys like, but for me, it's really nice to have a distinct start and end to particular things, and blocks is how that kind of works. So, I have a bit of a snippet attached here. You'll see that for block one, they start and then they end after 5 weeks. It's about becoming a doctor, kind of the overview. And then they go into different blocks about different systems. However, the other thing is that they also have some longitudinal classes. What that means is, for blocks, you have a distinct start and end. From week 1 to week 5, we'll be studying how to become a doctor, in this image. On the other hand, longitudinal classes are classes that go throughout the first 2 years. Throughout the whole year, okay? So longitudinal goes through the whole year. The blocks have a distinct start and end time. This is a reoccurring theme for a lot of different medical schools. Some medical schools will have, all longitudinal classes. Other medical schools will have blocks. It's another thing for you to get accustomed to what you like and where you think you'll be a best fit based on what school offers it, right? Because that's always great. The other thing that's pretty impressive is that classes are only 8 to 12 every day for the first 2 years. I say only because for most of you who come from undergrad, you know that classes used to be from anywhere from 8 a.m. to 8 p.m. The good part about it here is that it's standardized, 8 to 12, and then the rest of the day is yours. You can do what you want. So I personally found that to be very reassuring. Next up, the actual interview. So congratulations. This is the part that you should listen to if you have an interview at Case Western. And if you don't have an interview at Case Western, this is still a great way for you to get an insight into overall interviews. So, of course, if you know anything about med school interviews, and if you don't, that's totally fine as well, there are two types. There's the traditional face-to-face, I'm pre-rack, you're an interviewer, let's talk. Or there's the multiple mini interview, which a lot of schools in California do. Luckily, I personally am not a big fan of the MMI. I have a ton of videos on it that you should watch if you haven't already, but I like traditional more. And lucky for me, Case Western is a traditional interview school. So, based on my personal experience, they have 2 one-on-one face-to-face traditional interviews. One of them is with a health/educational professional. This could be anyone who's a doctor or on the admissions committee. This is usually someone who's higher up in the food chain and will talk to you about, why you want to be a doctor. It's 45 minutes. It's an open file interview. What that means is that they have access to your entire application. That means your personal statement, your extracurriculars, not your MCAT score, because they have access to everything except your MCAT score. So in this case, the personal statement, GPA, what classes you took, what classes you didn't take, what grades you got, they have all of that. And because it's from a health educational/professional, it's usually in the morning or afternoon, depending on that person's schedule availability. So the cool part is you might have it in the morning, you might have it in the afternoon. It doesn't really matter. It's 45 minutes long. It's a sit-down conversation, and I personally found it to be, great. I think it's a really good way to get to know your interviewer and for your interviewer to get to know you. On the other hand, the second interview you have is from an actual Case Western Reserve University medical student, which I think is great. They're making students a part of the admissions process, and I mean, who else better to know if someone should go to the school than the people who are already there, right? So the student has access to your name, undergrad institution, AMCAS experiences, and personal statement, but they do not have access to obviously like your grades. They don't have access to your MCAT score. They don't have access to like where you're. I think that's pretty much it. Those are the two most important things they don't have access to. So it's a partially blinded interview. It's 45 minutes. Or no, this one is 30 minutes actually because it's with a student. It's in the afternoon because as I mentioned to you earlier, the students are usually in class from 8 to 12. Again, this is purely from my experience. A lot of other schools that have traditional interviews also follow this process, and it's actually really intriguing. But here's the unfortunate truth about almost any med school. These are just specific numbers from Case Western. Case Western interviews about 1,000 students for a class of about 200 students. That's mind-blowing. Almost every med school will do something like that. Med school is hard to get into, guys. That is the big, cold, hard fact at the end of the day. It's hard to get into, and just getting in is a massive accomplishment. And, I did not get into Case Western. There we go. I got rejected. But I interviewed there. It was a great experience, and I think the school is great. But they interview about 1,000 students for a class of 200. So you have 217 matriculants, aka enrollees, and so make of that what you will. The college program, which I mentioned to you earlier, 5 years, fully funded Cleveland Clinic, is 1,100 applicants for 32 spots, aka 32 matriculants. So you can only imagine how much more competitive that is. I don't even want to go into that. Just giving you guys the numbers. I know the numbers are important, but just know that med school is hard to get into. But here, by watching this video, I'm sure you're taking matters into your own hands, and clearly you're taking initiative. So now let's finish up with just some fun stats. I know people love stats, but med school is not that simple, but unfortunately I have to give you the stats. But don't think that just because you have a higher GPA or a higher MCAT score, even a lower MCAT score or a lower GPA, that means that you won't get in, or if you have a higher one, that means you will, because there's so much more that goes into this, I promise you, okay? But just so you know, average person who goes to Case Western, who gets in as a first-year med student, has a GPA from undergrad of about 3.8. The MCAT score on the old scale was a 36, so if you want to convert that, there are calculators out there that do that now. I'm sure that's around like a 516 or something like that. Just out there for you. The class size for the university program is about 200 people, 32 for college. And here's a cool part. If you go to any school, make sure you ask the students there how much it costs to live there, because you're going to be living in a new place, and you should know. And I asked my host, and the host said it was about $700 to $900 a month, and that's pretty affordable, and they have off-campus housing, so you should remember that. This is something that might scare you, but it's applicable to any med school. I'm not saying Case Western's expensive. Every med school is about $82,000. That's just how life is, guys. Don't do it for the money. Doing medicine for the money is like the stupidest decision. You're gonna be in debt for a while. If you go to a UC school, they have lower tuition because it's in-state for me personally. But if you go to any private school, the tuition is about $57K, and then the total cost of living is somewhere about $78 to $82. That's almost always the case. That doesn't mean you'll pay $82,000. That just means that's the total cost. You'll get aid, you'll get assistance, I'm sure, but just know that it's expensive. All right. And with that, I always like to end with some fun facts. So Case Western's an old school, guys. It's a historically phenomenally famous school for a reason. It was founded mid 1800s, so you already know it has history. It was the first place where there was the surgical treatment of coronary artery disease. First place that it was found that iodine can be used to treat goiter, which all of you may know now. It was the second school in the nation to graduate a woman, which is obviously very forward-thinking. One of the 3 schools nationally affiliated with 2 nationally renowned hospitals, one of which I'm sure is the Cleveland Clinic. But I told you, they have amazing affiliations. And, just this really great other fun fact is students at Case Western actually do a musical parody in their second year, just of their peers and their professors. I think that's great. But, overall, this was my experience here. I hope you found this helpful. I know I personally would have benefited from this immensely, and that's why I'm doing it. I'm here for you guys. If you have any questions for me, let me know. But yeah, hope you guys enjoyed, and I look forward to hearing from you and making more videos. See you soon.